Today, we're talking about hydrating lip fillers. Hi TLCers, welcome to a new episode. Today we're going to be discussing hydrating lip fillers. But of course, we're not going to leave it at that. Of course, we're going to do a whole face job as well. Hydrating lip fillers, what are they and should you get them done? So basically, as we get older, we lose volume from the lip and we end up getting those little vertical lines inside the lip. You know, the ones that I mean, the ones that get lipstick kind of clogs up and almost cakes up inside them, and it means that the lip doesn't look as full and as plump as it used to. Well, you can use a type of filler which is more of a hydrating filler, just to give a little bit of, you guessed it, hydration to that area, but without really changing the volume or the contour of the lip. So I prefer to use one called Juvederm Volite for this area. I think it works really, really well. And it does give you just a little tiny bit of juiciness, but without really changing the overall shape of the lip. So if you're a bit nervous and you want to have something done, probably for these little lines, but you don't really want to have something that's too big done, that might be a good procedure for you. Let's take a look at our first patient here. So, never really had much done before. You can see that there's a bit of a discrepancy, first of all, in the eyebrow position, with this brow being a wee bit lower. And there's a bit more hooding over this eye right there. You can see that there's a bit of a volume loss right here in the tear trough area. And you guessed it, next to the nose as well, we've got a bit of volume loss right there too. And moving on down, you can see that she's got this quite prominent crease across the chin here. And in another earlier video, we discussed how having volume loss here can make your jowl look worse. So these are all areas that we can look at doing some correction for. Let's just take a look at her facial thirds. You can see that they are just slightly off. So her lower facial third is just a little bit too short. So we need to just try and extend the chin a bit if we can do. She does have a few fine lines around the eye at rest. I actually quite like them. I think they can be quite characterful. So I often will leave fine lines around the eye and I'll just look at the volume in the face. I think you can get away with a lot more if you find a feature that you don't mind too much and then you just leave it. So this tends to be the one that I prefer, either the lines around the eye, the horizontal forehead lines as well, sometimes I will leave alone. I might just decrease them maybe by 50%, but I never like to have that, you know, completely waxy sort of frozen expression look. I don't think it looks very good at all. So what did we do and how did we do it? So the first thing we did was use some Botox in the forehead, the crow's feet area, the frown lines. We also added some in the lower part of the face. So adding toxin here and here, it stops these muscles from pulling down on the lip quite as much, and it also helps to improve the contour of the jawline, which is quite nice. The next thing that we did was use some dermal filler in the cheek area, and you can see here I'm actually using a needle to do this treatment. Now if you've seen my previous videos, you know that I'm a big fan of using a cannula, but sometimes you've just got to use a needle. And the reason for that is if you've got a lot of tissue that needs to be lifted up, it's a lot easier to lift it using a needle. If you imagine, when we're doing the treatment, we lift back the skin and then we place the injection down just so that it's on top of the bone. Sorry, I hate the B word, but it is. And then we kind of do a little blob there and it forms almost like a tower that goes through the tissue. So when you let the tissue go, this product doesn't allow the tissue to come down quite as much because the filler's acting almost like a pin in that area and it's holding everything up, which is quite cool. So that's why we're doing it like this, because we need to get more lift. And now I'm going to finish up the contouring here using a cannula. And this is just again to give a bit more lift and to give a much nicer overall shape. If you just use a needle on its own, I find that sometimes the face can look too wide. You've created too much width because you place it directly on the cheekbone. But when you use a cannula, you can blend the whole thing in more, and it stops you from having these harsh angles and sharp lines there, because sharp lines are not good. Now we're doing some chin filler using a cannula. So we're going to go across the crease of the chin here, and what that does is opens up the lower part of the face, and it just drops the chin down a little bit, so it makes your lower facial third a wee tiny bit longer. And that's all we did in that first treatment session. So you can see the results of the first treatment session here. So let's go on to our second treatment session, because one treatment sometimes just isn't enough. You can guess what we did the second time around. As you know, sometimes we have to go back and retreat areas that we've already treated in order to get a really good result. So we went back in, used a cannula in front of the ear to replace that lost volume there. You can see what we're doing right here. Now we're moving the cannula down to the jawline to improve the angle of the jaw, because as we get older, we lose that nice sharp Angelina Jolie jaw angle, if you've had it in the first place, that is. So we just replace that volume there with a little bit of dermal filler. The next thing that we're doing is going on to treat the chin crease again. So the lower facial third still wasn't quite long enough for me, so we're going back in there to expand that compartment up again and try and push the chin down again a little bit more. Now I'm going back up to the cheekbone again to use a needle on top of the cheekbone. This is to really pull everything up and give us some good lift there. This is dermal filler again. And now we're using a needle and some filler where the jawline meets the marionette line, where that little divot is right here. If we can make that straighter, it will make her whole jawline look much straighter. Now, first of all, because she's got quite a lot of volume loss in the lip, if we left her lips alone and didn't add some volume in there, it would look really weird, because we've revolumized the rest of the face and then the lip would just look like this tiny, thin, scrawny little scrap of a lip there. So if you have revolumized the rest of the face, it is important to add a bit of something in the lip. So we're going to do that first of all using a cannula, which gives some deep volume. So it kind of pushes everything forwards just with the deeper volume. When you use a needle, all the volume that you place is superficial. So they're for different things really. So we're doing both the upper and the lower lip using the cannula. And we can also use the needle to lift the outer corner of the lip as well. Let's just have a look at her after pictures before we went ahead and used the needle. So in this picture, she has had her first lip augmentation done with the cannula, but we haven't used the injectable moisturizer yet in the lip. So you can see that between her sessions, we've got a nice improvement in the light reflection on the forehead. We've got rid of those little fine lines. We've also got some improvement in the eyebrow position. You see how it just looks that little bit higher here on both sides, and she just looks a bit more well rested. Moving down, we can see that she's just starting to get this lovely cheekbone coming here with a little bit of a shadow underneath on both sides, which looks attractive. And we've got rid of that flatness there on the front part of the face. And we've also improved this nose to mouth line by injecting just underneath the base of the nose there. And this is my favourite part. We've pretty much just erased this chin line that she had here, and these marionette zones look much better as well in the after picture. They've pretty much been erased there too. And she has, as I've said, had her lip augmentation done using a cannula in this after picture. She really doesn't have very much swelling, so it just shows you some people swell so much, some people hardly swell at all. But what we're going to go ahead and do now is use that injectable moisturizer directly in the lip. So it will swell up quite a bit because we've gone inside the tissue with a needle, and the lips swell, you know, more than anything else. So I'm going to show you that technique now. I do it just like a normal lip augmentation. She does get quite a bit of swelling at the end, but this swelling will go down by about a good 30 to 50%. So it's not going to be like this after a week. It's literally just because we've just done the procedure, guys. Unfortunately, I haven't seen her again since we did this video, so I can't show you the after picture. I say I haven't seen her. I have seen her because we work in the same building. But what I mean is we haven't filmed her again after we did this. But the next time we do some filming, I will certainly try and invite her along and see if we can have a look at it. Needless to say, I actually quite like it being that little bit bigger on her because she's got quite a wide face. If you look at the width there of her jaw, it's actually quite wide. So in people who do have a wider face, they can take a bigger lip. So I myself, even though I'm no fan of overinflated lips, I think it looks quite good on her, it being that bit bigger. I don't know. Let me know what you think anyway in the comments below. Would you think that that was a nice result if it stayed like that? Or would you prefer it to be a little bit smaller? Let me know what you think. That's it for this week. I hope you enjoyed the video. I'll see you again next week. Don't forget to like, comment and subscribe.